worlds.
Yes. Hello again. This is Dr. Tony from Chiropractic. I run the Crooked Spine Show. I'm here with Melissa Bunkers, correct?
Yes, yes.
She is my inflammatory expert, I call her. Okay. She has a revived method to help us with inflammation. Well, first, I want to understand what that is first, how it affects our body to cause our body to stay under stress. We call it the fight or flight response sometimes too. How do we get that to change and convert over to more of a relaxed state, a happier state where our body can actually heal? So, Melissa, give us your background. So what's going on? You're in South Dakota, so I'll get different time zones. So thanks for connecting with me today in your part of the world. All right, so go ahead, give me your background.
Yeah, so I have been in the healthcare field for over a decade now, which is crazy to say. But so I started out in the traditional medical world. I'm trained as a nurse practitioner, and so that's really where a lot of my background lies. But then I myself got sick. Adrenal dysfunction and some hormonal imbalances, and really got no answers from my traditional provider. And so that's what really led me to looking into alternative options. I came across functional medicine, healed my own body, and then wanted to help other people. So now I'm certified in functional medicine, and there's just a growing need for it. And so now I help other women, some men, but mostly women, heal, like get to the root cause of their health issues. So
what I love is you're able to integrate your medical background along with a little more of a natural approach also. So how do we make the overall body get better? So back to its normal state, right? A normal state of health is natural health. Could we get there and over time stay there? So so help us understand, what is inflammation? Where did it come from? And how do we, from that first part, from the beginning?
Yeah. So what is inflammation? Inflammation is the body's response to an insult, to an injury or an insult. There's a lot of different things that can cause inflammation. And, there's so many different, whether it's an injury or a toxin, stress can cause inflammation.
Huge.
Yes. So I like to tell my clients, if you think about cutting your finger and it hurts, it's red, it's inflamed, and sometimes there's drainage there, that's inflammation. And, people can see that, but that also goes on inside our body in response to the things we're putting in it and on it. And, the stressful life states that we live in. And, there's gut inflammation as well. So, inflammation is a good thing. We need inflammation to heal and repair, but it really becomes a problem when it's ongoing and chronic.
Good. So it's looking at, okay, what the causes of the inflammation. Is it acute, like I cut my finger? Okay, good. That is going to be your body's response to heal properly from the inside out. If inflammation is caused from a situation to where your body is overly stressed every day, okay, then that is a problem, more like you said, more chronic, more long-term. How do we distinguish between both of those? Is it the body's response where we start talking about assessments? Hey, what are you feeling? What is the secondary symptoms of inflammation?
Absolutely. So a lot of people, it can be widespread. There are so many, consequences of inflammation. It can be brain fog, depression, and mood symptoms. Fatigue is a big one, rashes, itchiness, gastroesophageal reflux, so heartburn, diarrhea. It can really be this widespread effects on the body, feeling puffy and stiff and achy.
It's almost like you're saying, okay, I've tried the over-the-counter medication for my intestinal issues. It's not working. This isn't working either. Is there a deeper cause of my body's response, stress response, to what I'm feeling in my body?
That's exactly it. And, I always use the kind of example, if you're sitting on a tack, do you want to just take a Tylenol to help that pain of sitting on that tack? Or do you want to remove the tack? Like, it makes so much more sense to remove the tack, go deeper, find that root cause. What is causing that pain? It's the tack. Let's remove that instead of just popping a pill to mask the symptoms, mask the pain.
And talk about too, with the pain levels and how pain works, how does the stress response or fight or flight kick in where we became that becomes our default state when we're having amount of pain or stress or things like that? How does that link together?
Yeah. So our stress response, so stress raises, so that's cortisol in the body, right? And so our body is actually, that helps with inflammation to a certain extent.
Yes.
But then if we are at that high level of sustained stress for so long, then it actually becomes a problem. And that's the issue is, our body needs a break from stress and a break from inflammation. And we're just so many things in our environment and our day-to-day lives, we're just not getting that break. That's what we
Called
call
a vacation, right? Take your
Yes.
vacations.
Yes,
You
exactly.
know,
Yep.
and a lot of it is find the things that we're going into that where we have to find ways to self-care our bodies, say throughout the day, weekends, whatever it might be.
Yes, exactly. And when I'm talking about stress, a lot of us think of it as that day-to-day grind, that emotional, mental type of stress. There's also a lot of other things that count as stress on the body. So we call those physiological or biochemical sources of stress. Those can be underlying chronic infections that, you might know that you have bloating, but you haven't figured out quite yet that it's small intestinal bacterial overgrowth, or it's a candida overgrowth, a parasite infection, something like that. That's also a lot of stress on the body that it's constantly trying to fight. And so that, people don't always think of stress as, an underlying infection. But in my practice, I go deeper. And of course, we talk about, managing stress on a day-to-day basis, mentally, emotionally, but also going deeper and finding those physiological sources of stress as well. It's huge.
And how do we, as a say layperson or someone who's not in healthcare, how do you distinguish? For example, I try to teach my patients to be their best doctor. Of okay, you've had this for 2-3 weeks now. It's not getting better. Those kind of medications. You tried other things too. What's the next step? Is that where you go? Okay, now I have to find a professional, someone like Melissa. Okay, walk me through. How do I find out what's causing the stress, which will cause inflammation, because the body's in a fight or flight state? How do I get out of this? Is it 2-3 weeks you wait, or what's the length of time to wait when you have something that goes that is you might think it's acute, but it actually might be chronic?
Yeah. So, it's different for everyone. But yeah, if it's an ongoing issue and, your one big thing is if you're going to a traditional provider and you're just feeling like you're not being heard, you're kind of being dismissed, or, they might give you a medication for something and it's kind of helping, but not really, or, you're on this medication now and there's other side effects that pop up that you're not really thrilled about, which happens all too often. And you try to come off the medication and your symptoms have just popped right back up, then it's really time to start digging into the root cause of things.
Is it a problem right now, especially with COVID being the last couple of years, to where it's hard to connect with your provider, your healthcare provider, to where you can actually discuss these things in a timely manner?
Oh yeah, for sure. It's our healthcare system is so, I was in the traditional medical world. I know that our traditional providers are so busy. They have I think the average visit is like 11 minutes, and that is just not enough time for your concerns to be heard, for them to really get to the bottom of what's going on. It's easier for a provider to just say, try this pill. This is what I have for you. Go home and try it. And that's the best we can do in the traditional medical world. And so
That's
yes.
not enough. That should not be the best though. That should not be what they strive for. I think a lot of it is, especially against Southern California, we're a more dense population versus South Dakota. I think you have more cows than you do people there. I'm not sure. I don't know.
Yeah, I think so.
I'm not sure. But a lot of it is if you call to see your provider, you will not see your provider for about 3 or 4 weeks. If you call for a phone, you'll make it a phone appointment, maybe a video appointment, but that's a 2-minute appointment with a doctor you don't even know, that doesn't even know your medical history. I had was last year, 2020, 2 years ago. I had a throat infection. I think it was throat infection. I had them probably every few years or so. And the doctor asked me on the phone, well, do you see yellow spots on your throat? I'm like, sure I do. I don't know. I can't see right now. I'm on the phone with you. So a lot of it is they're trying to get you through the system, give you a drug maybe that may help you, but not really see you. They may see this, but not the whole person. They don't ask about your lifestyle. They don't ask about, hey, what have you done recently? Have you changed your foods? Has your stress level changed? Have you changed your environment? Are you eating differently? These are things that someone like Melissa can walk you through versus someone who, through your healthcare system, isn't able to see that whole picture. I think a lot of it is we have to talk about people's well-being, not just their infection or their symptom at this point, correct?
Exactly. So with functional medicine, that's what I do now. And I look at the whole body as a system. Everything is connected. You can't treat one thing without knowing how the other systems work and how they all affect each other. And if I were to just, see someone for 10 minutes, there's no way I could get to the bottom of all of that. So I personally spend at least 60 minutes with my clients. In that very first visit, we go through all systems. I want to know all of your history way back from birth. How were you born? What were you fed when you were a kid? What environment were you growing up in? What were your traumatic events or stressors? All of that plays into your health and how your body is functioning now. And so it's super important to look at the body as a whole. You have to look at every single system. And so in the functional medicine world, I allow that enough time to be able to do that. And it makes a huge difference.
I think you go, okay, I'd rather help 10 people today than talk to 30, but have no idea because there's no follow-up, correct? When you talk through that way with your healthcare providers, they're like, hey, there's not a phone call 2 days later. Hey, how'd the medication go? Hey, how you sleeping? There's no follow-up.
Exactly.
Now to go back and go, hey, it's not working. What else am I do? You have to almost be your best doctor when you're in the medical system that way versus having a functional medicine, someone like Melissa, to help you walk through, hey, it's not working. What else can I do? Walk me through your system. How do you assess someone? You talk a little bit about it. Give us more detail on that.
Yeah. So when I first meet with someone right off the bat, kind of like I said, they have filled out an intake form before we even meet. And I have gone through and made my notes, and I've kind of mapped out symptoms of how I'm seeing things connect. And I'm kind of making hypotheses about what could possibly be going on. And then that's before I even meet with the client. So then I meet with them for an hour, and I start to, I give them the opportunity to tell their story and to tell me what their goals are, what their symptoms, what their struggles are. Who is this person behind all of this, physical stuff? That's huge too. But so then after that hour, I get a really good sense of, okay, this is where we need to go with, certain functional lab testing. And then the appropriate lab testing is ordered. And then we get those results back. We spend another hour. I make sure that you understand what is going on with your body and exactly the steps that we need to take to correct those imbalances. And I think that's a part of the traditional medical world too that's missing. People don't understand, like, why am I taking this pill? I would see it all the time. Like, well, you're on this whole list of medications. Why do you take this? So, like, I don't know. I don't even know what that is, and that's a big problem. And so for people who are coming to me, they really want to understand their body. They want to know what is going on, why am I feeling this way, and what can I do to fix it? And so my Revive method is what it's called. Good. It's pillars of health. And I specialize in a lot of hormone health, but so it's the pillars of hormone health. And I spend 12 weeks minimum walking my clients through those steps. So high level accountability and support, unlimited messaging with me. My clients get my cell phone number. We actually become really good friends because I am their, partner in crime in this. And I am there walking them through it every step of the way so that they can really see those results and, troubleshoot things if we run into roadblocks, which it's inevitable. It happens. And when we're getting to the root cause of issues, it's also really important to realize that nothing happens overnight. And so it's really important to have that relationship with a provider who truly, truly cares about you and about this transformation that you want, and creating that relationship with someone who is there every step of the way to make sure that you succeed. And that's just something you absolutely will not find in traditional medicine.
And with your pillars, walk through detail how the pillars work in your Revive method.
Yeah. So the first one is read your labs. So I want you to know, how to be an advocate for yourself so that in the future, if you do have to encounter traditional medicine, you have a little bit of understanding of what these markers are and what you can see from them. And, a huge thing is that I don't use normal ranges that you would see on like a typical lab report. I use optimal ranges, so they're much narrower, and that's something that I really like to explain to people.
Yeah.
Yeah. Yep. And so, you could fall anywhere within this normal range, and just because you don't fit into this box, you're told you're fine, there's nothing wrong here. And it's like, well, let me see those. That's definitely not optimal. And of course, you're still not feeling well, right? So we need to really look in these optimal ranges. And nearly 100% of the time, I'm finding imbalances in people who come to me saying, I don't feel well, something is off, because those normal ranges just aren't cutting it.
Well, it's almost a normal range is someone who might be 25, fit as a fiddle, versus someone who's 45 who hasn't worked out in 20 years and sits behind a desk all day and eats French fries. I don't know. I'm not talking about myself, but maybe someone like myself. I don't know. But something to where how do we find out, like you did with your assessment? At that point, this is what the person is. He's not going to fit in this big range. Let's say make it for him, so we know what's going on with him. What point do people go, you know what? I'm done with I guess typical healthcare. I need to see Melissa. What's a time frame for someone to make that step, that jump? What makes someone do that?
Yeah. So a lot of times my clients will tell me, I went to my traditional provider. They told me that, my thyroid numbers looked fine, but, then they do some research and they find that, these are the signs of low thyroid function, and they're ticking off the boxes going, I have this, I have this, I have this. There has to be something else going on. People are smart. They want answers. They know their body. You know your body better than anybody else.
Yes.
And so
Mhm.
just, they're told that everything's fine and everything's normal, but they know themselves better than that. And so that's what really drives people to seek out my help.
Almost like I'm paying for this insurance. It's not helping me. I have to go outside my box now because I'm being in my mind, and this is what they probably come to me with. Tell me I'm not making up my head. Tell me I'm not lying to myself. Tell me I'm what I think is common sense is working, or that I'm not. So they're almost come to you, hey, give me the truth.
Exactly. Yes. And being able to provide that validation for people is so rewarding. I mean, just from the very first conversation, even, I offer 15-minute strategy calls completely free to just start strategizing, talking through what's going on. Just in those 15 minutes, I just knowing their symptoms and knowing a little bit of their background, I'm able to give them that validation that, this might be common. You and your neighbor and, your coworker might all be experiencing the same thing, but that doesn't mean that it's normal. That doesn't mean that that's the way you have to live.
It's not the average is not the average. Normal is not someone's health. And always tell someone, be above the average.
That is exactly it. That's exactly it. The state of the country now, the average is obesity, type 2 diabetes, heart disease, high blood pressure, kidney disease. Do you really want to just be considered average and normal? And that's kind of where I get back into the labs too. You don't want to just fall into the normal range, do you? You want to feel great. You want to feel optimal and be functioning optimally.
Do you have also groups that you work with, or have a community of people that you work with? Because I would assume once you're in an optimal level, you're going to go, okay, now this is my normal. I'm above my average of my community. How do I maintain this? Do you have a group that allows them to actually work with themselves? Hey, I know you're not doing well today. Let's get you motivated again. Let's get you back on track.
Yeah, so I do, my clients, I have created a community. So there's a Facebook community, which I think is super important to, identify with people who are going through the same things as you, to bounce ideas off of for accountability and things like that. Yes, I think community is a big part of that.
I think a lot of it is when you have your community and you've been helped by Melissa and you understand where your body's going through. Now you want to pay it forward. How to help the next person. And you're almost making yourself, you're the leader of that group. Yes, we make little leaders too that allow them to share their stories. So they trust, they may hear you, but they may trust their friend Sally because she's gone through it also. She's seen the result. She's seen the full circle, the 180, 100, what is it, 360 degrees or 180 degrees, whatever it is, getting that full circle where now I'm better. I spent the 12 weeks getting better. Now my body is here because I've learned about how to treat my body better. I've learned how to read the labs. I've learned how to read where I should be versus where I was before.
Exactly. Yeah. And kind of like you said, I'm creating these little leaders throughout my my community that can then go out and even help other people. And whether or not, someone comes into my program and I personally work with them, now I've created other people who are just aware that this is out there, that functional medicine is out there, and that, you don't have to settle for just covering up the symptoms. And so, yes, absolutely. Then other people can go out and spread the word, because, we're still in the minority, you and me, with, chiropractic and getting to the root cause. Chiropractors, it's more mainstream now than it used to be. Absolutely. But functional medicine is certainly just kind of starting to be on the cusp of things.
Why is functional medicine growing? Why do you think people are gravitating toward it more?
I think people are just they're not getting the answers from their traditional provider. I think that as a society, we're getting sicker and sicker, and we're seeing our loved ones suffer. We are suffering ourselves, and just not getting the answers that we want from traditional medicine. And I think there's a lot of resources out there now. So people are doing more research on their own and coming up with different ideas. And, a lot of times in traditional medicine, you'll take an idea you have to that person, and they might just kind of completely dismiss it and say, no, like, stop Googling. That's
a myth.
Yep, exactly.
It doesn't work. Functional medicine doesn't work.
It
causes a stroke or something.
Right.
That's a lot of it is, but when there's a high demand for your services, then traditional medicine has to wake up. They're like, hey, we're losing dollars from our healthcare system because people don't want to see us anymore.
Exactly. Yeah. Right. Yes.
So you become part of you become the mainstream, because now you've almost become your community, allows them to demand a better quality of life.
Exactly.
I think a lot of people are paying more out of pocket for their own healthcare, because they realize their quality of life is not based on an absence of disease or symptoms. It's based on how your body can actually get to a higher state of health.
Absolutely. I totally agree with that.
Easy. And walk me through a success story you've had recently with one of your clients, without names, because I don't want to cause any HIPAA conditions.
No, thank you. Yeah, thanks for that reminder. One client right now, oh my goodness, this is a good one. So, we were starting to talk about inflammation. I have a client now. She is, in her 30s. Very high functioning, businesswoman. And she came to me with swelling all throughout her glands and in her face and in her fingers. And, knowing that she probably likely had some thyroid issues. She knew that coming into it, but hadn't really dug into her lab work from a functional standpoint. And really, we got her labs back, and she had Hashimoto's, so an autoimmune condition, which is highly driven by inflammation in the body. And so I put her on a personalized protocol, unique for her needs. We talked about food sensitivities and lowering that inflammation, and talked about all the different ways she could do that. Within 10 days, this swelling in her neck and in her face and even in her fingers, she went down a glove size at work. She is in healthcare. And within 10 days, she had been going to her traditional provider for 2 years saying, I am swollen. There's something going on here. And it was just completely dismissed every single time. With functional medicine, we dug deeper, got to the root of it. And within 10 days, she just looks different, and she's feeling amazing. She's lost 10 pounds, and our work together is just getting started. So it's pretty
almost, when you see the results that quickly, now the mindset shifts. Okay, what else can I do? Now the mind goes almost, okay, I'm on the right track. I get this thing going so I can get better and stay better, correct?
That's exactly it. When we talk about motivation, those little wins all along the way really provide that motivation. So really getting clients that, it's a balance between rapid relief, because, as we've been talking about, I like to get to the root cause, which can take some time, but that's not to say that you're not going to experience some rapid relief right away with the interventions that we're going to implement.
And by doing the face-to-face talks with your clients, you get to understand their mental state as well as their physical state.
Exactly. That is a huge part of it. And when we were talking about my Revive method, the next step is actually easing stress and healing the adrenals. Good. And so, we talked about all the, physical, physiological areas of stress, but absolutely the mental, like mindset is so big. If you don't believe that you can heal, that your body will get well and wants to be well, then you're not going to get very far. So we really have to address, who is this person? What beliefs do they have? What triggers, as far as stress and things like that, what's going on in their life to cause stress and mental turmoil.
When you said with 12 weeks, you're able to help them actually get through that mindset, also that psychological change as your body heals, right? Because when you're in pain, as people know, you become anxious, you become fearful, you become more of a negative person. And because you're drained also, you may not even sleep well. Then once your body changes, then you also have to change also that default attitude to more positive attitude, correct?
That's absolutely correct. And, that also comes back to, in the beginning, giving them small wins so that they have that positivity. And even something just like, starting to do something like a gratitude journal, thinking about all the positive things in your life, even if you feel like you're, at rock bottom, we really work with people to try to figure out, where's the small wins and the positives that really can build momentum to keep going.
Good, good, good. Did we miss any steps on your revive method?
Yeah, there's a few. Yep.
Good. Yeah, let's get through them.
Okay, so the next one is vitamins and nutrients. Super important.
Okay.
A lot about what you eat, obviously, is a huge one.
Mhm.
So and that also supplements plays into it a little bit there too, but food, as we know, is the best way to fuel our body. If we don't have a backup pantry of nutrients, and so if they're not coming in, then our body just doesn't function optimally. The next one is improving gut health. Now, a lot of inflammation can start in the gut. A lot of chemicals and dyes and substances, like certain medications that we're putting into our body, causes inflammation along that gut lining. Our immune system, 2/3 of it lives right along that gut lining. And so, which is constantly surveilling everything that we put into our body. So gut health is super important, the balance of good bacteria. The next
What does
one.
it take to get the balance? If you have an off balance for one too by your testing, what's it take time wise to increase, say, probiotics or supplements like that to get that lining to a better state of health?
Yeah, that's a great question. So, especially with someone with like an autoimmune condition where there's a lot of inflammation, I put someone on a supplement right away to start calming that inflammation down. And that's usually a good 2 to 3 months of that. But first, you want to remove food sensitivities. So, two of those things are gluten is a big one that people not only are they sensitive to, but it creates a lot of inflammation in the gut. So, a lot of times we have to greatly reduce our intake of gluten, which, if we're eating whole natural foods, we automatically sort of push out the gluten. So that's one of the first steps. And then we can start to heal the gut lining. There's supplements for that. There's supplements for everything if you wanted to go that route. But things like bone broth, organic bone broth, super soothing and helpful for calming inflammation in the gut. But that usually, 2 to 3 months of really focusing on nourishing that gut lining is a good timeline.
Well, a lot of people, once you talk to you, Melissa, at that point, they're going to go, okay, this is what I like to eat. This is what I like to do. Versus going, I'm going to go on Amazon and buy all my supplements. I'm going to buy the ones you need or get the ones you need me to get, but also I'm going to now eat the foods that are good for me, what I'm eating already. Correct?
Yeah, absolutely. And, a lot of people come to me saying, I've tried this, I've tried that. And, there's so much information out there. What I really, what's missing from a person like that is someone who's trained to know the steps of healing. There's a definite order of operations, especially in something like gut healing specifically. That's a huge one where people say, I've just kind of been researching and trying this and that, but not getting anywhere. And that's because there's a definite order of operations. And so sure, you can go on Amazon and buy any supplement you want, but it really takes a trained eye to get you the proper testing and to be able to see exactly what's going on and lead you through the right steps.
And I believe that because a lot of it is, like you had mentioned, the 2 to 3 months of being on a supplement and over time changing it as you go. People take a supplement for one bottle and go, okay, I'm done. I'm good.
Yeah.
It's not enough sometimes. And again, you're going to be able to assess them and go, okay, maybe 2, maybe 3. Let's see how in your processes, like you had mentioned. getting people to understand where they are right now and continue to update their assessments. So as they improve, at that point, you can adjust things. As they're not doing better, something else is affecting them, can readjust again, not waiting until their primary talks a month later. So you're
That's
addressing them on time all the way through.
That is exactly right. And you know what works for one person doesn't work for another. So just because like your neighbor tries one supplement and it's working for them, well, now, say you try it and it's not working and now you're back to square one, you really need someone to be able to, give you what you need at a specific point in time to be able to adjust the plan accordingly so that you can continue to make progress. The other thing I see too is a lot of people starting on supplements or, a certain, health plan and continuing it for years and years, which can actually do more damage than good. And something that just came to mind, vitamin D is a big one right now with everyone, concentrated on immune function. Vitamin D is a pro-hormone and a steroid. And so if what happens if you get too high levels of vitamin D in the body, that can actually suppress the immune system, which is exactly the opposite of what you probably started taking it for in the first place. So that's just one example of how, being on things long-term when you're not really sure if it's right for you or, the duration of what's appropriate, it can actually do more harm than good.
It's almost turning your mind off to the commercial, the ad, the marketing of that supplement and going, okay, is this really good for me? Like you had mentioned, all our bodies are different, right? Our body chemistry or physiology is different. Me versus you versus somebody else, completely different. So we have to treat our bodies individually, not based on what the bottle says, what the benefit is on TV or on the radio, whatever you can talk about.
Yes, that's exactly right.
Good. What is the other method or what is the other pillar of Revive?
Yeah. So victory over inflammation. So we started to talk about that a little bit. So specifically, taking kind of a toxin survey of your environment, creating a healing environment. So eliminating or greatly reducing the toxins in your home and beauty products. And, it's not about reducing things to a level that's zero. That's just not realistic. We're always going to have, contact with some sort of toxins, but I like to refer to it as your toxicity bucket. And so if that's overflowing, then there's a big problem. Then you're outdoing what your body can handle as far as nutrient status. And then again, that comes back to food. If you're not bringing on the right nutrients to detoxify those things. So, then you can see how everything starts to really connect in the body. So yes, home and beauty products, your things, especially that touch food surfaces or that are sitting next to your skin all day long. So I tell people, laundry detergent is a good place to start. Lotion is a good place to start. Deodorant, those things that sit next to your skin or touch your food. So, simple things like switching from plastic to glass food containers is just so super simple, yet it can really create more of a healing environment for your body and lower inflammation, which allows your body to just start to heal itself.
I told my wife too during the holidays, I think she had bought different detergent for our laundry because my pants got way too tight during the holidays. Is that a possibility?
Yeah, I haven't heard of that one, but
may want to use that one. Go back to Costco, I guess. I'm not going to do. Okay.
Yeah.
And then with that, which I agree with too, if you're putting stuff on your skin is porous. It absorbs right to your bloodstream. It affects your overall body. So when you read your label of your skin product, say skin lotion, can you understand what those ingredients are?
Yeah. So, it's there's a lot of, you can barely pronounce those things, right?
Yeah.
But so fragrance is a big one. I actually the other day had a client come to me and said, I found this great this soap place, and they told me that it's all natural and non-toxic. And I said, what's the brand? That's great. Let me look at it. It said fragrance. And so that's a huge red flag because you don't know what that means. Fragrance can mean a lot of different chemicals. And unfortunately, that's not non-toxic. Those are some of the most highly toxic substances to put on and in your body.
Like you said, you're teaching your clients how to read labels, what to look for in the environment, maybe their foods, their skin products, even what supplements you're taking too. You're teaching them to become their best doctor. So at that point, even when they don't see you in the future, they can go, hey, I know how this works. I know how things. So like you said, your Facebook, going back to that again too, it'll help your next clients or other little leaders out there to help promote the good knowledge that you're giving them.
Yeah, and that's where it also comes back to, like you said, being your own advocate, because there are so many companies, claiming to be non-toxic, claiming to be, even food, like organic, clean. Like, what does that even mean? So I really help people work through some of those muddy waters there, so that they can advocate for themselves, and so that they can kind of see through some of the BS, if you will.
Yes, it's when you talk about marketing, it's mostly BS.
Yeah, it really is. It's a big problem. So
You're able to, you're like to give them that filter. Okay, is this really good for me or not? Let me check with Melissa, or I've done this before. It's a repeat pattern. Let's make sure we walk through this so it's good for me and my family and my kids. This was going with each of us too.
yes, yes.
Other pillar. Is there a hormone supplement or check with that too?
So hormones. So these are like the pillars of hormone balance. So once you get all of these things sort of in check, hormones just kind of tend to follow suit and to fall into balance. So yes, I do use supplements with hormone for hormone balance, but that's kind of really tailored to what your labs might say, what your symptoms. Estrogen dominance is a big one. That's where estrogen and progesterone become imbalanced in the body, and so that can happen for a variety of different reasons. One of them being toxins. Certain chemicals in the environment act like estrogen in the body. And so then you can start to see how, eliminating toxins and lowering inflammation can actually help balance your hormones. The other thing is your thyroid hates inflammation. So when there's a lot of inflammation going on, that actually raises something called reverse T3, and that can compete with free T3 to get into the cells to actually do what it needs to do to create your metabolism. So inflammation can create a whole cascade of hormonal imbalances.
Is inflammation your signal then, hey, something's wrong with your body?
Yes, absolutely.
Got it. So when you understand that, okay, then I can go down this rabbit hole, figure out where things are, having Melissa on my side to make sure I'm doing the right things and not testing the waters versus doing the right things the whole way. I always like having a coach because it saves you time, and down the line it saves you money. You just do what Melissa says, and that's all you got to do.
That's right. And, a lot of people will say, I took this supplement. I wasn't really sure what I was supposed to feel or how long I was supposed to wait to see if it worked. And so, again, that's where working with someone who's knowledgeable, who has the experience to know, what's a good time frame, when should we be seeing results, that makes things so much more, simple for you.
You're saving yourself time and just trial and error. Like, I don't want to, if I'm a woman and also take a supplement, I started growing facial hair. That's not a good thing. No.
That might not be the best. Yeah, that might not be the right one for you.
That small size, that small, you couldn't read it because you have your glasses on, that little side effect at the very bottom of the bottle.
Exactly.
Have you walked through the pillars yet of your Revive method?
Yeah. So, the last one was eliminate toxins. So kind of goes with the inflammation. So yeah, that's the Revive method. It's a proven method for helping women reduce inflammation, balance hormones, lose weight, lose the bloat, and just their energy skyrockets and they feel amazing.
And as a takeaway, can you go through the Revive method one more time? Each one you hit to make sure we have it. So I'm going to do a clip of this so people understand exactly how you help them.
I love that. Thank you. Yeah. So we're going to read your labs, ease stress and heal the adrenals, vitamins, nutrients, and supplements, improve gut health, victory over inflammation, and eliminate toxins.
Yes. It allows your overall body, in my mind, to understand where you are. If you're in a sick state, get to a healthier state, and then learn your own, like you said, your best advocate for yourself to understand how to stay there.
Yes, exactly. And like we talked about before, I'm there with you every step of the way. We walk through, the module, the step of the method gets dripped out to you. You get to, kind of consume it in your own home. And then we meet and we talk about it and create goals and action tasks and to just really skyrocket your results.
It's almost you're their health coach, nutritional coach, your mental coach. I don't use psychology, I like that word. And that one allows them to get the overall well-being perspective. So their mind, their body, their heart, their spirit feels well.
That's right. Yes, exactly. So it's a whole health coaching program. And so I kind of cover all of the bases.
Yes, yes, yes. Anything else for your first show where we're getting to understand how this works?
I'm sorry, what was the question?
Anything else for your first show? Anything else you want? I missed that you may want to add in.
I think, taking a multidisciplinary approach is really helpful too. So I work with a group of women, the Wellness Collective here in Sioux Falls. I do see women virtually from all over the country and the world. But I think, I always encourage people I am that, a mental health coach and a nutrition health coach as well. But sometimes I have to acknowledge that there are things that are out of my realm or out of you know, my expertise in a certain to an extent. If I'm identifying someone really could benefit from mental health therapy or massage or chiropractic to get things lined back up, then I will make those recommendations if I think that's appropriate. And I have seen results just skyrocket from using that multidisciplinary approach.
It's almost the complementary treatments from other specialties allows a person to get to that next level of health, and then hopefully maintain that. So now they know it works for their body, correct? Everyone's different.
Yeah, exactly. So having a whole team of people behind you who are rooting for you, and if those providers can talk amongst themselves even about your case, even better. So at the Wellness Collective, we have people sign releases of information so that every week we can actually sit down and talk about the mutual patients that we have. And hey, this is where we're hitting a roadblock here. Like, let's brainstorm this. Is it, mental health? Is it a mental block? Is it, they need more movement or, a chiropractic adjustment, whatever it may be. We can collaborate and you have a whole team of people behind you. So
you almost have like a second, third, fourth, fifth. There's like 8 people there, a lot of opinions to help. Like I said, you're gonna have a conclave to go, okay, how do we help this person the best?
Exactly. I mean, more eyes, the more sets of eyes, the merrier, right? So yeah, and you don't find that everywhere. Of course, in the traditional medical world, there's specialists and things like that. But how often I hear it all the time. People say, well, people aren't on the same page. Like, so-and-so didn't talk to this other provider. And now, I'm having this whole rigmarole. I'm trying to get a hold of this office and this office. And then you end up being the person to collaborate those conversations. And so, yeah.
How many, I can't give the number of seniors I've had talk to me, seniors, 65 and over, that have come to me and go, I saw this doctor. They sent me this other doctor. The doctor had no idea why I was there, did not know my medications. Didn't realize on this medication, they gave me this medication that interacted with this medication. Now I'm worse than I was before. So that communication, that lack of communication, not only does it help someone not get better, but also can harm someone too, correct?
That's exactly right. And, we go back to the fact that traditional providers, not only do they not have time to meet with people more than, the average 11 minutes, do you think they have time to collaborate with each other and talk to the referring provider before, they see you? Absolutely not. They're just going by, a note that they see in your chart, which, that doesn't give the whole story either. So
it's almost you're putting your health at risk, or a family member's health at risk, by not doing your due diligence to make sure, hey, is this the right thing I should be doing? Is this what I should be doing? You're having no one to check in with you or you to check in with on a consistent basis.
Yeah, absolutely right. And, there's definitely a time and a place for traditional medicine. I don't want to sound like I'm, totally against it, because there's definitely a time and a place. Like, thank God that we have, antibiotics in certain cases or emergency departments for those acute things. But when it comes to overall health and wellness and up leveling your health and some of these chronic things that can be prevented and actually reversed, we're missing the boat big time in traditional medicine.
Yeah, I mean, if I lose my finger, for example, and it doesn't come back, at that point, I have to say, doctor, I'm kidding. I have all my fingers. Okay. I'm a chiropractor, my fingers, right? But I have my finger. I want to put back on. It's great for emergency medicine. It's not that long-term, they said, quality of life, health, getting someone to where not only their disease may be gone or outside of your considered range of levels, but now their quality of life is in the back where it needs to be. And then getting there is really, it's outside of, even unfortunately outside of the realm of your health care system, getting to your healthcare is talking to someone like Melissa can help you walk through all the steps to get that quality of life better and maintain that health.
Yeah, absolutely. And, me being trained in traditional medicine, I can, I definitely have a keen eye for like those red flags, so that I can refer you back to traditional medicine if you absolutely need it so that nothing gets missed. And so you can be rest assured that, I'm still watching out for those things that might be an issue. But as long as I'm not seeing those big red flags, then I'm like, okay, full steam ahead, traditional medicine, let's go the more natural route. Let's change our diet and lifestyle, things like that.
It's a combination. Like you said, you can go back and forth so you know when to refer, when not to refer, and when the really big picture helps somebody. It helps them doesn't mean just what you can do, but outside Wellness Collective, out to traditional medicine. At that point, you know exactly how to help someone get better and stay better.
Yeah.
Wow. Good. Exactly. I learned something today, so thank you.
Good. Awesome. I'm glad.
I hope you like my bad jokes too. I appreciate it.
I did. Yes. Thank you.
Anything else that I missed?
I don't think so. We covered a lot today. It was good.
We did. I think you helped a lot of people understand inflammation is your sign something's wrong. When medicine, I want to say, disappoints you, at that point, can you do a 15-minute call with Melissa to understand, is there something that you can't see because you're not in healthcare? You don't have a degree in healthcare. You don't have Big Alone like I have, Big Alone, that allows you to see these things that we have through our experience, seen for years. So give Melissa a call, connect with her on the post itself too. I'll have ways to connect with her. At that point, she'll be able to guide you through healthcare. All right. So anything else, Melissa?
You know what? I actually have a free resource. So on my website, it's www.revivefunctionalmed.com/inflammation. And there's a whole checklist there, just some very practical tips that you can take, even if you're not going to come work one-on-one with me for 12 weeks, just taking some simple actionable steps can start to lower inflammation in your body to allow it to heal. And so that you feel fantastic.
And what I'll do in the post notes too, I'm going to do is I'll adjust them to show that also that link. So they'll have that along with your Facebook group also you have on there. So you get to that too and get things started. All right.
All right. Sounds good.
Nicholas, I'll stop the show and we'll talk a little bit more off topic. Okay.
Thank you.
Thank you guys for watching.